was presented in the 51st Media Convention of Association of Nursing Service Administrator of the Philippines, Nurses Week 2019 at Philippine Orthopedic Center, the 21st National Institute of Health University of the Philippines Manila Conference in 2019, and second Patient Safety Congress in 2019 at the Philippine International Convention Center at Vicente Soto's Pasay City. The title of the paper was Patient Safety Culture Among Nurses at the Philippine Orthopedic Center. Let's call on Ms. Catherine Kaligdig.
Good morning, everyone. I'm Catherine Kaligid, and together with me is Ms. Rosana Ramos. We are going to present our research study entitled Patient Safety Culture Among Nurses at the Philippine Orthopedic Center. So before we start our presentation, we would like to thank the organizers of the POC 75th Anniversary Scientific Forum and Research Forum for giving us the opportunity to present our research study. And I'd like to call on Ms. Ramos. So for the interest of transparency and to help you form your judgment on the potential bias of the study, we declare no conflict of interest. So our discussion will go as follows. As we all know, patient safety is one of the essential tenets of patient care and is considered a critical component of healthcare quality, influenced by other healthcare dimensions, which includes effectiveness, efficiency, timeliness, and appropriateness. It underpins excellent healthcare and is established as the culture of patient safety. Evidence shows that there is an association between the implementation of safety culture in healthcare institutions with the decrease in adverse events and mortality that will lead to the improvements in healthcare quality. The current attention on measuring and improving patient safety in hospitals has brought to the fore the concept of patient safety culture. It has a vital role in delivering patient care and protecting patients from harm. Assessing the hospital's existing safety culture is the first or initial stage in developing a positive safety culture. So, as nurses providing care to our orthopedic patients, we recognize the magnitude of importance of the culture of patient safety as a crucial element of quality healthcare and the significance of a positive safety culture that underpins all activities that revolve around the patients. So the general objective of our study is to assess the patient safety culture at the Philippine Orthopedic Center from the perspectives of nurses using the Agency for Healthcare Research and Quality Hospital Survey on Patient Safety Culture. So specifically, our study aimed to describe the demographic profile of the nurses. Second was to determine the perceptions of the respondents of the composites or dimensions of patient safety culture. Third, we aim to identify the proportion or percentage of adverse events reported in the hospital in the last 12 months. And lastly, we aim to determine the overall patient safety grade of the hospital as perceived by the respondents. So a quantitative descriptive cross-sectional study was conducted to assess the patient safety culture at Philippine Orthopedic Center last June to December 2017. A total or complete enumeration were staff nurses and nurse managers in all areas who have been working in the current setting for at least 6 months and who consented to participate in the study was conducted. So, nurses who were asked to complete the survey knew the day-to-day activities of the hospital, interacted regularly with staff working in the hospital, and had a direct or indirect contact or interaction with the patients. Registered nurses who were on sick leave, maternity leave, and those who were on vacation leave at the time of data collection were excluded from the study. So the Agency for Healthcare, Research and Quality Hospital Survey on Patient Safety Culture was utilized for it is well known and widely used. It has a good psychometric properties. It was tested on large sample, has comprehensive coverage of safety culture elements. It has a good supporting document and benchmarking data is available. So for the results and conclusion of the study, I'd like to call on Ms. Ramos.
Good morning, everyone. So a total of 292 nurses completed the survey, yielding a response rate of 86.65%. The questionnaire data were collected through in-person distribution, which maximized the number of completed questionnaires and allowed the respondents to ask questions. The data in the table describe the demographic characteristics of the nurses who participated in frequency and in percentage. So the clinical nursing unit provided the greatest number of respondents. The age group of 25 to 29 years old topped the study population and was dominated by female nurses. More than half of the respondents were single, and most were baccalaureate degree holders. Respondents were dominated by Nurse 1, and more than half have worked for less than a year in their present working units. Also, almost half have been employed in the hospital for a year but not more than 5 years, and most were already practicing their profession for 1 to 5 years. Lastly, almost all of the respondents involved direct patient interaction. So this table displays the perception of respondents of the different composites of patient safety culture. So of the 12 composites evaluated by nurses, teamwork within units was the highest positively rated dimension, followed by organizational learning, continuous improvement, while non-punitive response to error was the least positively rated dimension. They consider teamwork within units as a strength of the hospital because they may view the importance of cooperation and coordination among the workers in achieving a positive and safe climate for patients. They also considered organizational learning, continuous improvement as a strong point in the hospital due to the increased number of seminars, trainings, and workshops being facilitated by the Nursing Training and Research Department of the institution for the improvement and advancement of the skills and knowledge of the nursing workforce to empower them to become future nurse leaders. The least reported response was non-punitive response to error, indicating that the nurses were feeling threatened if they report errors. The result may mean that nurses were probably vulnerable to blame and punishment in the hospital. So according to the 198 nurses who responded, there was no adverse event that occurred in the hospital within the past 12 months, and almost 1/4 of the nurses reported that there were 1 to 2 events. So this result showed that since the patients in this institution were protected from errors, injuries, accidents, and infections, the hospital was good at keeping their patients safe. But on a different note, the relatively low occurrence of adverse events may be attributable to several factors. Studies based on retrospective assessment of information may underestimate the true rate of adverse events. So when asked to evaluate the overall patient safety grade of the hospital, majority of the nurses reported that the patient safety actually is very good. This means that given that patient safety is a critical component of health care quality, the hospital had somehow achieved the good culture of safety that warrants an understanding of the values, the beliefs, and norms about what is crucial in this institution and what attitudes and behaviors associated with patient safety are expected and appropriate. But overall, the nurses feel positively toward patient safety culture in our organization. Again, let me emphasize that in general, nurses feel positively toward patient safety culture within our hospital. Our study findings showed that nurses working in the hospital, like its counterparts in other countries where perception about patient safety has been studied, value teamwork within units and organizational learning, continuous improvement as important aspects of patient safety culture. Examining the patient safety culture of the hospital can help identify the existing gap in the system. The dimensions focusing on non-punitive response to error and staffing indicated areas that require improvement. So initiatives are necessary to improve response to errors, staffing, communication, and error reporting. So let me just mention that this research endeavor was funded by the Philippine Orthopedic Center, and we want to thank the following. That brings us to the end of our presentation. Thank you very much for your attention.